we don't think that COVID really causes an increased risk of diabetes, but we know that people with diabetes are more likely to have severe COVID. And we know that 1 in 3 people who have diabetes don't actually know they have diabetes. So a lot of people, their first contact with a health provider for maybe years was when they were sick with COVID or sick otherwise and were worried they had COVID, or found out that they were at higher risk for COVID because they were obese or had other risk factors. And so maybe they were actually attending to see a health professional for the first time in a very long time, and they got tested. So we think that's really more likely why there was more diagnosis of diabetes. But there's also the possibility that when people were very sick with COVID, they got given steroids during sort of hospital admissions, especially if they had underlying lung disease like asthma or COPD. They would have been given steroids to help their breathing, whether they were in hospital or not. And steroids can trigger diabetes.
You're saying that perhaps one silver lining to during this pandemic is that more people going to the doctor might have been diagnosed with diabetes, and they had it and just didn't know they had it, and it was just getting into the doctor to get that test.
Absolutely. So what we all want, well, physicians anyway, is that people get diagnosed with diabetes or pre-diabetes, or that they are aware they're at risk of diabetes way before they ever have significant concerns with very, very high sugar levels, starting to develop complications. People who go to the doctor for the first time because they've got a severe foot infection and finds out that they've got diabetic neuropathy, they can't feel their feet, and they've probably had diabetes for 10 years and they didn't know. So we want people to be checked and screened early so that they can be given the right education, so that they can avoid progression, and then hopefully never need to see me as an endocrinologist dealing with the sort of severe, out of control diabetes.